All right, thank you, everyone. I guess we'll get started. My name is Mark Abraham. I'm with A&M Industrial, and I'm going to kick off this session, although I'm not presenting. I want to thank everyone for joining us this morning. This is the first in our series of weekly informational webinars. Many of you know that we last year did our A&M University. This year we've had to delay A&M University, so we're calling this virtual A&M University as we do these webinars. And we thought, what better way to kick it off than with something that really everyone is very interested to hear more about. So we'll talk about that in just a minute. So quickly, again, people, mostly you're familiar with A&M, and we just wanted to highlight before we start. We most recently published our new interactive product guide, which is online. But again, it highlights, just before we start, the different things that we do. We're very active right now with safety and cleaning products for the virus. But again, our main businesses include precision cutting tools and abrasives, mill supplies, again, all safety PPE as well as safety related services, tape and packaging, pipe valves and fittings, tools and equipment, fluid handling hose assemblies, janitorial and cleaning supplies, which we'll talk about today, material handling and storage, as well as VMI, where we actually manage your MRO supplies. So all that is part of what we do. But today, we're really going to focus on the aspect of cleaning for the COVID virus. I also just wanted to highlight, if you go to our website at anm-ind.com, we have a whole separate menu, a whole separate page, all related to items specific to the COVID-19 response. So a listing of items, everything from goggles and cleaning products and gloves and eye protection and everything you might need related to the COVID-19 response, as well as some specific other products we've highlighted, including, as you see, signs for your area to talk about social distancing and things, warning signs, all related to the virus, as well as other products you can go to our website and see after the webinar today. Today, we're very fortunate to have Ken Bickerton. Ken is VP and Senior Consultant with Phase Associates. Ken has over 25 years in the health and safety field, including comprehensive practice in safety and industrial hygiene. Ken has developed cleaning protocols and emergency response plans for COVID-19 and delivered training to Customs and Border Protection agents in New York and New Jersey airports and on Ebola. What we'd like to do now is have Ken actually present, and we're going to hold all the questions till the end if we can, but have Ken present his material. It'll take roughly 30 minutes, and after that we'll have plenty of time for Q&A. Okay.
All right, thank you very much. You'll have to give me control to move over. All righty, good morning, everyone. Again, Ken Bickerton, with Phase Associates, and we will be covering COVID-19. Again, just a quick recap. I've been with Phase Associates now for 16 and a half years, going on 17, and have been involved in the health and safety profession for over 25 years. And as was mentioned, Phase Associates in general and myself specifically, we've been involved with a number of companies just as the virus crisis was ramping up and getting some emergency action plans put together, some cleaning protocols. We're on call for a number of clients now when they have either people who are suspect or actual confirmed cases of COVID-19 on how to respond and how to follow hopefully their prior written plan so that they can get the person taken care of and keep their workplace functioning, even if it's at a slightly reduced capacity until the cleaning and disinfection has taken place. All right, we've heard about COVID-19. It's ad nauseum on TV, but I just wanted to point out this is known as an enveloped virus, and what we mean by that is that the RNA strand is surrounded both by protein and by a lipid or a fat layer. This is important to remember during the cleaning and disinfection phases, in that it is a fat, and fats, as you know, will dissolve in soaps and other type of soap materials along with alcohol. So these are typically easier to clean and render non-viable than unenveloped viruses. So that works in our favor. Right now, without having complete testing of all population, we're now just targeting our testing. We're looking at somewhere between 1 to 3% mortality rate in the US. That is more than 10 times greater than our seasonal influenza, which is typically somewhere less than 0.1%. So that's, one of the reasons why there's such a concern. But we need to keep in mind that most people will recover. Many people will not even know that they've had symptoms, or if they've had symptoms, it's been very mild. There will be a percentage that will have a more significant event where they will have many of the typical symptoms that this virus is known for, and may even get to a point where they lose taste and smell and such. And then there will be those that will need some serious medical intervention. And this is why this flattening of the curve is so important, is so that we don't overwhelm our medical facilities. The last point on this slide comes from a study that was published in the New England Journal of Medicine. There was a study done on this particular virus on its viability, and viability means it's still in an infectious type state on various surfaces. And at this point, they were finding on plastic it would survive for upwards of 3 days. Other materials, the survivability time period was much less. Again, working in our favor. So let's talk about the transmission. How are we getting it from person to person? And much of this hopefully is just a recap of what you have already learned. Upwards of 25% of the people who have the virus are asymptomatic, meaning they don't even know it yet, and they may never know it. And this is not much different than some of the hepatitis viruses, where there are many carriers out there, but they don't realize it. But those folks at the same time can release the virus material, typically through coughs and sneezes and generally talking, for upwards of 2 days before they would show any symptoms. And that's one of the scarier points of this particular virus. People could be walking around, not know they're infected, and be dispersing viral material about themselves for upwards of 2 days. And this transmission can be in one of two ways, either through the air or on surfaces. And let me just talk quickly about the first, and that's droplet spread. As you know, when you cough or sneeze, there'll be mucus type materials that will project out of your mouth and nose. But these particles are generally pretty large, and because they're large, they have a great amount of weight, and that weight will cause them to drop very quickly to the horizontal surface below. And originally we thought that was a 3-foot distance. Further studies over time have found that that could be up to a 6-foot distance. And that's why we have that social distance of 6 foot that gets pushed by the Center of Disease Control. This is not what we call airborne. So if we have the cough or sneeze, we'll have the large particles, but then you will have some very small droplets, and they don't even call it droplets at this point. That may go a further distance, but they're finding the virus is much lower in concentration and is made less infectious further out. And so the concern isn't so much a surface 10, 12, 14 feet away or in an HVAC system. It's more just the general surface around that person. And that leads to your contact spread. So that is where any of these droplets around the person have fallen and settled onto either a vertical or horizontal surface. It will be present, as I mentioned in the earlier slide, upwards of 3 days of being infectious. And so that's where the cleaning and disinfection protocols will need to come in. And there has been a lot of question over, you know, the FedEx guy shows up, the Uber Eats person shows up, even in your water treatment plants and your sewage treatment plants, what's getting through the sewage system. They have found that these are really not viable routes, and so there are no known transmissions through these routes. So I know that many people concerned, but there really isn't an issue in that sort of contact manner. All right, well, in doing the cleaning and disinfection, we will, and I'll cover a little bit more on the next slide, we do have 3 sort of categories or classes to contend with. We have the first one where we don't have any concern. There's no reported infections. There's been no reported people coming into the facility that have had close contact with an infected person. The second is that person under investigation. They have had very close contact with a known person with the illness. And then the third class is somebody has come into your facility and has been confirmed as having the COVID virus. And so that helps determine how we're going to attack this. And that will go into both the level of cleaning, how thorough are we going to be in this, and what sort of protection are we going to put that person in when they're doing that cleaning. And areas that you need to take a look at. Where did that person go? Was it an employee? Where did that person go? Was it just to their workstation? Is it a locker room, a restroom, a break room, or cafeteria? It might be even, they may be in the shipping, receiving, or more of the shipping area where they may be getting into a vehicle and driving out to client locations. These all have to be identified. You need to identify who else they may have interacted with, whether it's in the facility or outside the facility, so that we can also start doing the contact tracing of this person and making those folks aware that they have come in contact with somebody. And that will also be with contractors. Now, yesterday I was at a power generation plant that was on their schedule outage. They had 250 contractors on site. Well, there's a big concern there. And so everybody's logged in and logged out. Everybody has got a temperature check coming in and questions. So these are other areas, and any other visitors that come in. Scopes of areas. Generally, you're going to have two types of areas. You're going to have those that are porous surfaces, such as carpeting, chair cushions, cubicle fabrics, draperies, any of those sort of items. And then you'll have non-porous. Those are desktops, countertops, any other hard surface. And they are handled somewhat differently. Non-porous is much more straightforward. A porous surface now, because of all the nooks and crannies, and we'll get into the EPA approval process of disinfectants, really can't be claimed as being fully disinfected. It's really on porous surfaces, cleaning, and a disinfectant was applied. If you start claiming disinfection of a porous surface, you can get yourself in some liability trouble there. So if you're doing cleanings, you need to use the right verbiage. CDC, again, Center for Disease Control, did come out with a recommendation last week that states if the facility or the space has been unoccupied for 7 days, the thought is the virus is now non-viable. It may still be present on the surface and can be picked up with testing, but this would be non-viable material. So if it's been vacant for 7 days, they're recommending that cleaning and disinfection not have to occur. All right, cleaning. Simply detergent water in many cases. You don't really need to get into anything sophisticated here. There is consideration on what type of material you're using for cleaning. And there have been studies or there's been some advice that normal cloths, cotton cloth, rags, items like that are not appropriate for this sort of situation. The advice out of the American Biorecovery Association is that microfiber cloths be used. And in this case, they can either be sprayed directly with the detergent, or the surface can be sprayed with the detergent, and then the cloth be used. Important though, that clean portion of the cloth be applied as you go through the cleaning process. So you may be cleaning on one side of the cloth. You may even be folding it, and they advise folding it into portions so that you can unfold and keep putting a clean surface out and get further distance with that cloth. But once they become visibly soiled, or if you've now cleaned upwards of 12 square feet of surface, they're recommending that you discard that cloth and start with a new one. So again, we don't want to be pushing this material all around. Keep finding and using clean microfiber cloths for doing the cleaning. All right, once you visibly remove the visible or adhered on debris on a surface, then we're able to do disinfection. You cannot really do disinfection before the cleaning process, because if there's visible soil or adhered soil to that surface, the disinfection agent cannot get to the surface and do its job. So disinfection will follow cleaning. You need to use the EPA approved disinfectant. There is an N list, and I have a reference to it at the end of this presentation. It is disinfectant agents that have been approved for corona viruses, but have not been directly approved for COVID itself. But the belief is, if it's like the other COVID viruses, then it would be effective on this virus. One of the important things, and an area that I had seen non-adherence to, is contact time. Now, when the EPA approves these disinfectants, they approve it on the basis of a minimum amount of contact time, meaning surface wetness with the disinfectant agent. And if you do not allow it to sit for its full recommended contact time, you cannot assure the client or your own employer that it's been properly disinfected. So it's very important. Even bleach, the dilute bleach solution, the CDC is saying you need to have it wet for at least 1 minute of time. So as you're using these products, you need to follow the manufacturer's recommendations. Alcohol is allowed, a 70% or greater. 70–80% is kind of thought of as a sweet spot. Where would these be used? Typically, if it's on electronics, keyboards and other sort of electronic devices, once they've been unplugged and de-energized, to spray it on the cloth, and then to wipe these non-porous surfaces. The thought is on alcohol, it does not leave a residue, and the water and alcohol will evaporate. So there shouldn't be any residue on any of the electronics that may cause problems going forward. And as I mentioned, dilute bleach is allowed. The emphasis here is that the bleach solution be made up fresh essentially every day, and the beginning bleach solution not have passed its expiration date. You cannot make up a solution today and expect it to be effective on Friday. So it needs to be made up as you need it. Another sort of sticky wicket and a liability concern and a cover your butt sort of concern is, how do you prove that you've disinfected this surface? Well, really there's no approved method for this at this moment. There will be remediation companies that will use what's called an ATP test. It's an enzyme that's present with bacteria and mold, and they'll use that as a surrogate to say that the surface, if I've cleaned and disinfected enough to have removed the bacteria and mold on that surface, then by extension the virus has been removed. There's been no studies, to my knowledge, that have proven that correlation. And so if somebody is saying it's past my ATP, it's been disinfected, they're overstating the claim there. All they can really claim is they've done a very thorough job of cleaning that surface. And what's more important in my thought is supervisory oversight. And whether that's somebody in-house or if you're using a trusted remediation company, that a foreman be watching over and ensuring that the cleaning and disinfection process has been done as been outlined in a written protocol. So for example, they're doing the disinfection and they're using micro cloths, but they're now cleaning 20 square foot surfaces with that micro cloth. They're not following the protocol, and therefore there's concern that the surfaces weren't properly cleaned and disinfected. So you really need to stay atop, whether you're doing it yourself or overseeing somebody, that they're following the protocols as set out by the CDC and the American Bioremediation Association. I mentioned the 3 classes a bit earlier. The first is more of the proactive cleaning. This is, again, an area where we don't have a concern. What we're really looking at here are high-touch surfaces, and we've heard these before: door handles, light switches, telephones, shared keyboards, areas in a break room. We need to make sure these stay clean and disinfected as best we can, so that if somebody is asymptomatic and has left viral material there, we're getting it addressed and not allowing it to spread to the other population of the facility. Person being involved doing this, it's recommended that they protect their eyes with glasses, that they protect their respiratory, because there may be splashing of material, and that would be what everybody's hearing is an N95. There are different classes of 95, N or P95, and there are greater efficiencies. There's 99 and 100. So I know that there's a problem getting and sourcing N95s. You may ask your vendor if there are other types available. And nitrile disposable gloves, so that they keep it off their hand, and that they properly remove these things after they're done. Class 2, again, we have a person under investigation, a PUI. And in this case, we want to be interviewing this person to know where they've gone, so that we can now go to our regular high-touch surfaces and really concentrate on where this person has been, so that we can really clean up after them. So our PPE in this case is going to be as mentioned up above, but we're probably going to want a coverall, because they may touch into a surface that hasn't been cleaned and disinfected with their clothing or with their skin, and we don't want that to happen. We may want booties, so that as they leave an area, if it's a concentrated area, they can remove the booties, and now we're not tracking this with our shoe soles throughout a space. And 2 sets of nitrile gloves, one in case the outer set get torn. And those who know about deconning and such, you want a pair of gloves so that as you are removing your PPE, you're not recontaminating your hands and such. And in this case, if you've used any tools, you'd want to be decontaminating these tools. Class 3, highest level of concern. You're going to do everything that you've done with Class 2. The CDC also advises that you open up windows and doors and allow outdoor air in to dilute anything, and to typically dry the material out and desiccate it faster. So again, it reduces the viral load on any surfaces that may have been impacted. And then who can do this sort of cleaning? Well, for the first class, in-house janitorial cleaning staffs are typically going to be capable of doing this sort of cleaning. You know, they're involved, and hopefully they're involved with bloodborne pathogens training, and they know about gloving and putting glasses on and properly cleaning and disinfecting surfaces. Once you start getting into class 2 or 3, it's going to cause an increase in training levels for whoever's involved here, because we've got additional PPE requirements. We've got COVID specific information we've got to pass through. They may be required to wear respiratory protection now, and that's a whole respiratory protection program that you need to put in place. And if we're making people put on respirators, that's medical clearance, training, fit testing, the whole 9 yards. You know, they need, and typically they should have had their HAZCOM training anyhow on cleaning agents and disinfectants, but if we're bringing in a new disinfectant, they need to be instructed on that particular material. And we may be asking for more personal protective equipment. We may be asking, or it might be advised, that a face shield be worn. The coverall may not be something that typically used to, or the booties, or double gloving. And so they need to be, their PPE training needs to be beefed up to cover these new aspects, especially removing this material so they don't contaminate themselves. So if you can get your own cleaning crew geared up and trained up, and you feel comfortable having them do class 2 and class 3, then that would be fine. But if not, make sure you're using somebody who's reputable, who's got some experience. The American Bioremediation Association, they're an example. They're not the only group out there who have companies involved who really kind of do training and know what they're doing. I'm not a member, so I'm not pushing them, but they've got some really good resources there. We've got this crisis at hand, and hopefully you haven't had to deal with it in-house. But even if you had, we've got one client I'll be doing some work for. They've got their response, and they've been dealing with this. They've had 3 positive employees over a period of time in their facility, but they really need to get it committed to paper. And so that will be part of my task, is putting it to paper, reviewing it, and making sure they've got a response plan that really is effective, and where everybody knows their responsibilities within that plan. And it's much like an incident command structure, for those who are familiar with that. You essentially delegate duties so that nobody is overwhelmed, but somebody does take ultimate charge to make sure everything is being done. And that's anything from actions of prevention. Before it arrives through your threshold, what are you doing? How are you monitoring community? How are you monitoring your own people? What's your cleaning protocol? Do you have somebody set up if you can't do the class 2, class 3 cleaning internally? How are you going to get that done? And then you have in there, something's crossed your threshold. It's come in the door. What are we going to do, both for employees or contractors or visitors? You know, what's your response? How are you going to do contact tracing? How are you going to interview this person? You know, how are you going to deal with the folks who have not been affected? This person has been in my building. I may work on the other side of the building. How are you going to calm that person down? All right, so you need to cover all these things before it happens. All right, here's some references. The CDC, you can get even on a sort of newsletter or news alert with them, and they're constantly updating their information. World Health Organization has a lot of good information. The US EPA List N. This is constantly evolving, and so if you're looking to use a product, go and see if it's listed. And this list also gives you the contact times that they've approved. And again, these approvals for contact time on hard surfaces, and they've never been verified on porous surfaces. the study I mentioned earlier, the New England Journal of Medicine. And if you've had a facility that's been closed for a period of time, the American Industrial Hygiene Association has a good reference document dealing with having a building shut down for a period of time, going in and looking for potential mold issues that may have surfaced while it was vacant. Your water supply, has it been moved with enough frequency that we've eliminated any potential lead concentration buildup from fixtures or Legionella bacteria buildup? These things really need to be addressed before you start reopening a facility after a period of time. All right, and a quick blurb on Phase Associates. Gary Schwartz, who I believe will be joining me with some of the Q&A piece, had started this firm, I believe, 23 years ago. I've been with him for as I said, over 16. It's a comprehensive consulting firm on occupational health and safety. We've got a lot of experience. We've got certified industrial hygienists, certified safety professionals, associate safety professionals, licensed mold assessors. So you can go on a website that I've listed there. You kind of get further information. But we pride ourselves in the fact that probably over 80% of our business is repeat business. So clients seem to be very happy with us. So if you've got questions, feel free to contact us. If there's something that's going to be more in depth, then we can talk about some sort of arrangement where we can work with you to get your issues addressed. All right. With that, I'm going to turn it back over. I'm going to stop my share, and I'll let A&M take back over again.
Well, thank you very much, Ken. Right now, people can use the chat function and ask any questions that they have to me, and I will forward them that way. And one other thing here, we can, I wanted to mention that A&M and Phase have worked together, and what we propose is a number of more advanced classes that we can offer together. So after this is done, by the way, we will email Ken's presentation to everyone who was on board. So this will be included. So you can reach out to A&M, or again, we have a separate email address for these classes. You can email to university@am-ind.com, and there will be a series of paid classes that people can take if they're interested. That's one of the options. And at this point, basically, if you have any questions, now would be the time for Q&A. I have a few questions that have already been forwarded to me. So Ken, if you can start with these.
Sure.
The question I got was, for porous surfaces, how do you suggest they are cleaned and disinfected? Should cloth surfaces be sprayed and left to dry, or spray and wipe similar to hard surfaces?
Okay. What we've been recommending for carpet and such, you can do a steam vacuuming or steam cleaning. They're still working on what temperature fully inactivates the virus, but the steam cleaning will extract a lot of this soil and debris. And the thought is a lot of the viral material is adhered to that, and so you'll be decreasing the amount of viral load on those materials. And then generally spraying with a disinfectant. Wiping it really will not get down into the crevices. So spraying and then allowing to dry. But I would just check with all these disinfectants that it's compatible for the surface that you're going to be using it on, because you do not want to cause damage to the surface.
Okay, and the next question I have is, says, do we know of any studies suggesting the need to clean HVAC systems?
Okay, the studies that I've read about so far, and I'm on a number of list servers and such, is that there at this point, there is no concern of it being brought into an HVAC system on a non-healthcare sort of facility. So let me just preface that. If it's an office, it's a warehouse, a manufacturing, the belief is that it is not an airborne spread, meaning it will not disperse throughout the room and then get brought into the HVAC system. Healthcare can be a different sort of consideration because they generally have a much higher air changes per hour, and they're really exhausting air from those rooms, and that velocity of air may be able to pull it up into an HVAC system. But at this point, for general sort of considerations, they're not recommending cleaning and disinfection of the HVAC system.
Okay. Next question. Can paper towel be used in place of microfiber cloth?
I've not heard of anybody recommending paper towels and such. I think part of it, besides not being well enough to absorb a lot of materials, it may leave fiber back on the surface as the paper towel breaks up. And so I would probably advise against it and stay with the microfiber cloth. And I think one of the A&M gentlemen had sat in on a webinar last week, and there was concern over cloth and other type materials not being very effective.
Okay. Next question. What's the difference between industrial grade nitrile gloves and medical exam nitrile gloves? Are they both as effective as the other for COVID-19? And also, is there a certain mil thickness maybe, and different grades of gloves? What should people know about gloves?
I would think there's really, the nitrile glove is going to afford protection from contact with the surface, and that's really the overriding factor here. We're not dealing with permeation or degradation of the glove where it will migrate through to the hand surface. It's just more of a consideration of, will it tear easily? Because you don't want these gloves being poked and torn easily. So I'm not real familiar with the very thin sort of surgical glove. But if people have experience with those and they don't puncture or tear easily, then they would be just as effective.
Great. Next question. How many times can we use the mask, a P95 or an N95? What's safe in terms of how many times can they use a mask?
Wow, there's a lot of issue with this, and you've been following any of the news. This has been discussed. What I'm personally doing right now is I've got 3 or 4 masks that I cycle through. And what I mean by that, I'll wear one mask, and because I'm working generally at home and occasionally will be going into a facility, after I've worn that, then I will hang that in the open air, generally in my garage right now, because I know that the viral material will not last beyond 3 days. And so the second day I'll wear the second mask, third day I'll wear the third mask, and then the fourth day I'll go back to the first mask. Now, that being said, if it was a healthcare sort of situation that I was involved with, I might be changing or not reusing them as often, because the amount of viral load on the exterior will probably be considerably higher, especially if I was doing any patient handling. But they are advising medical folks that if they place their mask carefully in a porous bag, like a paper bag, and then remove it gently, that they can be reused for a period of time. There has been an expedited FDA approval of a gaseous hydrogen peroxide disinfection protocol that the healthcare industry and others are going to start taking a look at. But there haven't been any other proven disinfectant methods on the N95s at this point.
All right, Ken, next question. Is ultraviolet being used anywhere? Why or why not? And if so, where do you find it's appropriate?
Ultraviolet, there's been a lot of talk about that on surfaces and even on the N95 mask for disinfection. For very small targeted areas, UV light may be appropriate, but if we're talking about a room, that starts getting too large of an area. And part of it is the energy level of the UV light has to be at a certain energy level for it to inactivate the virus. And there's got to be a minimum of contact time with the virus. So it's two factors, the energy and the time of exposure. And it's very difficult to use UV light in any sort of larger sort of area versus doing it inside a sort of UV chamber or cabinet for doing disinfection of small items. So on a large scale, it's not being used.
Okay. Can N95 masks be cleaned and reused?
As I said, at this point, the disinfection with gaseous hydrogen peroxide has been the only one that's been approved for disinfecting. The N95 filtering material does have an electrostatic charge associated with it, and that is one of the reasons why they're so effective. And there's a concern of using detergent water and washing it as such will reduce the electrostatic charge on the fabric, and it will make them less effective in filtering out any material. So at this point, nobody's being advised to wash them or to clean them in any manner.
Great. Okay, just a few more. Are the store-bought Lysol and Clorox wipes effective?
Yeah, they will be effective, I believe, again, but you need to pay attention to the contact time. I'm not sure on Lysol what the minimum contact time is. Several of these, and when we did the Ebola training at the airports, they were using a disinfectant spray, spraying their countertop and wiping it. And then I asked them what they were using, and they gave me a can, and I said, you know, the can says you need to have it stay wet for 3 minutes for it to disinfect. And all these eyes lit up, and nobody ever told us that. And I'm like, well, that's why we're doing the training. You need to adhere to the manufacturer's recommended contact time.
Okay. Ken, you talked about in electronics, you could use a solution that had 70% alcohol, but could you comment on the use of disinfectants with 60% alcohol or hand sanitizer with 60% alcohol? Is the CDC approving that? How does that work?
The CDC right now for disinfection of surfaces is recommending a minimum of 70%. And again, studies are showing 70 to 75, 80% as being a sort of sweet spot. You need to have a certain amount of water. If you start having too much water, which you have at 60%, it's not as effective. But we use 60% in hand sanitizers because we don't want to dry out the skin so badly that we now have contact dermatitis, which can lead to other skin conditions. So there's kind of like a dispensation for your hands so you don't have dry and cracked hands.
Okay. Can you use microfiber cloth if they have been washed, basically reusing a microfiber cloth?
That's one I've not really read about, but if it's much like what they're talking about with porous materials that can be laundered, they are recommending that you are able to launder it in the hottest water that you can launder. You know, so I'm not sure what your hot water heater is able to be set at. And I don't want to guess the number. I have a number in my head, but I don't want to give out any misinformation. But CDC does recommend laundering at a high, you know, on your highest temperature in your washer for handling anything, clothing that may have been sneezed or coughed on.
Okay, I have two more questions. It was mentioned that the virus lasts for 3 days on plastic. Is there any difference on industrial metal surfaces, or is the 3 days there as well?
I believe on a number of surfaces, metal surfaces, they're finding that it has a lesser viability time. So it would be less than a 3 day. 3 days is kind of like the worst case at this point that they've studied and a peer-reviewed article has come out on.
Okay, finally, when you say contact time, do you mean how long the area needs to be in contact with a disinfectant agent? Is that what you mean?
Yes, it needs to be physically wetted with the agent. If it dries out, it's not considered contact time anymore, and it has to be re-wetted. We did a large employee exposure survey for a pharmaceutical company where they were using a disinfectant in their biosafety cabinets, and the minimum contact time for that material was 10 minutes. And so they set a timer at 10 minutes, and if it was drying out, they resprayed the surface and didn't touch it until that 10 minutes was up. So yeah, it's the amount of actual wetness where it's able to do its action.
Great. Okay, Ken, I want to thank you for the informative session and answering all those questions. I thought that was great. I want to mention that again, we will be sending out an email to everyone where Ken will share his presentation with us, and we'll get that out to everybody. And if you have any interest in any of those things, you can follow up and call us. And I also wanted to mention next week's class, just so you're aware, and we'll get information out this afternoon on our website. We'll have the information this afternoon. Next week's class is about respiratory protection, led by some experts from 3M. All right, again, I want to thank everybody for attending, and thank Ken again. And with that, we'll sign off.
Thank you.
Thank you very much.